To be honest, I didn't think I would even be here this year.
A lot has changed in Chris Gordon's life over the past year. He started not feeling well at work last April. He eventually went to the doctor, and that is when they noticed a spot on his right lung, later diagnosed as stage 4 lung cancer.
It was actually quite a shock. Both my parents I lost from lung cancer as well. So, I mean, it was definitely, something scary.
Gordon says the first few months of his diagnosis were tough. He could hardly move around on his own and had to immediately start treatment.
How you been feeling?
It was during that time that he also met his oncologist at Novant Health, Dr. Garrett Sherwood. He's the director of the Thoracic Oncology Program, hoping to beat the stigma behind lung cancer.
A lot of patients are afraid to be diagnosed with lung cancer because of what they've seen happen to friends, family members, etc., what they expect will happen following their diagnosis. But thanks to research and progress, that's not the case anymore.
I mean, he listens to what I have to say. He told my wife basically when I first started coming here that he hadn't given up on me, that he was, going to fight. He's a really good doctor.
A good doctor who watched Gordon go from a wheelchair to back walking on his own. Gordon now using his free time hiking, averaging around 40 miles a week. He's also no longer on chemotherapy, only seeing Dr. Sherwood every 6 weeks now for routine checkups. Both Gordon and Sherwood remind the community that anyone with lungs can get lung cancer, and if you have concerns, to get screened.
If you're eligible for screening, which is anyone between the ages of 50 and 80 that's smoked for 20 pack years, if your physician isn't bringing it up, you need to bring it up to them.
It's important because I think it's the same as any other cancer. The earlier you catch it, the better. You're going to be better off.
I really appreciate Dr. Sherwood and Chris Gordon for telling their story for me. Some risk factors that can increase someone's chance of developing lung cancer include a history of smoking, radon, exposure to asbestos, or family history of lung cancer.